Hello and welcome to yet another edition of E-Expressions for the New Indian Express. I have with me Professor Ravi Gupta, who's just been nominated as one of the 100 most influential people by Time magazine. And for a reason. He is the person who's behind the second person to have been cured of HIV in the world, called the London patient. A very complicated procedure which only the professor can explain. I'm not a scientist. But more than that, he's also been at the forefront of the battle against COVID and has very quickly adapted whatever he knows to let the world know what we can find out about this deadly disease. So thank you so much, Professor. And of course, the whole of India is rejoicing at your being part of the list. You know, Indians love Indians abroad who do well. So I have to ask you, how Indian are you in that sense? Because we, of course, love to appropriate successes abroad. We'll talk a little about that, and then we'll get into right away into really what do we know about COVID now?
Thank you very much for that kind introduction. Just in terms of how Indian I am, I mean, I'm very close links with India. My extended family is all there, many in Delhi, many in Agra and Lucknow, and also Calcutta. So I still very much feel Indian. And although I was born here, we've spent a lot of our best memories in India. So I'm very honored to be Indian at this point, actually, to be able to kind of give something back to India and to represent, you know, my sort of my motherland, as it were. So very special time for many reasons, and I'm really pleased at the way that I think that all of the winners or the nominees have been kind of portrayed in the media in India in a very positive light. Yes. during a very difficult time for the world, you know. Yeah.
Right. So, Professor, let's get into what we know about COVID right away. Before we, or let's talk a little first about HIV and what we know about HIV, even 30 years after the disease first caught our attention. We still don't have a vaccine, which sometimes is scary when you think of the possibility that there could not be a vaccine for COVID-19 for 30 years. Where are we headed?
That's a really interesting point, actually. So many diseases have vaccines. If we try hard enough as humans, we have eventually found vaccines for all the things we have been trying to deal with. But HIV is the one exception. Huge amounts of money, billions and billions of dollars in vaccine research for HIV. We haven't been successful for a number of different reasons, mainly to do with the virus and the way that it manipulates the human body and subverts the immune system and changes itself constantly. These are the main barriers for HIV. Now, with coronavirus, we're not really sure how this is going to work, as to whether, you know, the same problems will arise. We know that coronavirus mutates much more slowly than HIV in general. So maybe that will be of benefit to us, but we can't be sure. We know, on the other hand, that coronaviruses change themselves each year, and you can be infected multiple times by coronaviruses, even when you have had immune responses, because for some reason they don't seem to last very long. And this is a really interesting thing, because immunity often is supposed to last many, many years after you see a pathogen or a virus or a bacterium. But for some reason, this doesn't seem to be true for coronaviruses, and this could be the Achilles heel for vaccines.
So when the world talks about this disease being here to stay, it is true. Whether it's in this form or a far deadlier form or a far lesser form, we have to live with it.
I think that's a reasonable assumption based on what we've seen. I think in the early days, we thought we could overcome this with our usual kind of, you know, spending lots of money on science suddenly. But actually, I think we're becoming more sobered by the things we're seeing. And I think it's better to prepare to live with the virus rather than to believe that it's going to disappear. Because vaccines may be successful, but they may need reboosting every year or every 2 years or every 6 months, in which case there will still be cases of coronavirus popping up and down. We will still need to be vigilant and in terms of controlling infection. So we need to prepare for the worst.
And exactly how do we keep that up? We keep up with our masks, our social distancing, the sanitizing. What are the things that we need to do absolutely need to do to make sure that we are living in this new normal?
Yeah, I think we need to do all the things you just mentioned. All of these sort of classical approaches to infection control, they will need to be continued. This will be the new norm. We need to just make space between each other, and I think use telecommunications more than we do in-person meetings, which is already becoming difficult because the spontaneity of a personal meeting can't really be replicated very easily. So we just have to make do with what we can. Travel is recommencing, but I think that travel really is a key to reintroducing infections. And I think we need to, the world travel business really needs to restart, I think, but in a way that that is safe. In other words, with intensive screening and obviously precautions on aircraft as we go forward.
Professor, you said something very interesting a little while earlier that, suddenly there's a lot of spending on science. It's very interesting because you had very anti-science responses from some of the world's leaders, whether it's President Trump or even Prime Minister Johnson. It's been very skeptical. They've been very skeptical of evidence that has been put before them of exactly how deadly the virus is. What is going on there?
Well, I think
why is the political leadership so skeptical of something that's so obvious?
Well, I think we can talk about Trump more than Boris Johnson, because I think Boris Johnson is still having to listen to advisors and hasn't openly criticized scientific advice yet.
Also, because he had it.
That's right. Yeah, that's right. He was sick with it, so he realizes this is important. But I think with Trump, of course, the problem is that his whole motivation or reason he's there is to do things for people, to be seen to be doing things. And of course, it doesn't really matter to him whether something is working or not, or whether it's real or not. He just needs to show himself and others that he's a low average, drug. In any other disease, it wouldn't have made it to, use in the clinic, but because we're so desperate, it's being used widely in some areas. So we don't have proper therapeutics, and we don't have a vaccine. And of course, there are patients who are getting very sick and dying. So we have many challenges, antiviral development, anti-inflammatory drugs, for example. These are all critically needed, and they're as important as a vaccine in many ways. In terms of what is the virus doing, it is an RNA virus, which means it does do some mutation. It is changing a little bit. There's one mutation that arose that seems to make it more infectious. This mutation has basically replaced nearly all of the strains circulating in the world, suggesting that this virus, if it does mutate, can adapt very quickly and spread itself very quickly. So we do need to be mindful of that, especially when we talk about vaccines, as we may have a long fight ahead of us, as we saw with HIV.
Professor, do we know exactly how it originated?
So it's, the Wuhan wet markets is where people suggest it originated. I think that there are some conspiracy theories. I don't believe that it was an intentional event. I don't think that scientists went out to make a deadly virus. I do, on the other hand, think it's plausible that the virus was an escape from a lab. Wuhan does have one of the highest level containment labs you can find, and there are only probably 10 such labs in China. And so it is a small coincidence that the outbreak happened in a city where such a containment facility was located. So I do have some questions in my head about that. But I don't think it's intentional. It's and really we just have to deal with the consequences now, but also to invest enough in science and enough in coronavirus research such that we will have an array of drugs and vaccines the next time this happens, and we won't have to go through this process again.
Professor, it's been a horrific time for healthcare workers, and not just, of course, for people infected with it, but people who are dealing with the infection and dealing with the infected patients. How broken is the healthcare system in, in your country, in India? How much do you know of that?
I mean, here we prepared for a very significant first wave, and although many deaths occurred, the health system just about coped. but that was at the expense of many other procedures, operations, healthcare, cancer treatments for other people. So there was a lot of damage that happened as a result of diversion of all the resources away from other diseases towards coronavirus. So, and that's the really big thing that worries me about the longer term impacts of this. There's a dual impact. One is the patients themselves, but also the other patients with other conditions who are not receiving the treatment they need.
Right. Do you know enough about how India has responded to the virus?
I know a little bit about the way there was a lockdown announced. Of course, a certain period of time was given to people, but because there's so much migrant labor, of course, people tried to get back to their homes, I heard, in villages, and therefore was sometimes stranded, had to walk a long way. So unfortunately, the good intentions potentially were derailed by the realities of society. And this is an interesting thing. We saw this with HIV, that these viruses and these diseases that affect us are fueled by the social and unequal conditions which we have created in the world, the economic conditions by which capitalist economies flourish. There are some downsides to this, in that we become vulnerable by the way we have created our societies.
Yes. And also in terms of the low mortality rate in India. In India, that's being seen as something that's something at least to look at as a silver lining. And there are varying theories about this. What can you tell us about it, Doctor?
Well, there are a couple of different things to consider. One is whether the numbers are real. It's very hard to measure accurately the number of deaths that are occurring. Many people will not make it to hospital. We certainly heard here that people couldn't get beds in Indian hospitals. And so what about all the people that have died at home because they didn't believe they had enough money to get into hospital? So number one question would be, what are the real numbers?
Right.
And I would be hard to convince that, good quality data could come out in the conditions that we were seeing, certainly in India's first wave. Secondly, yes, perhaps, of course, the second thing is that India has a younger population than many other countries in Europe, and age is correlated with disease severity. So that may be playing into the numbers that have been observed. Then there's a theory about the fact that in certain countries, tropical countries, there is a greater burden of infectious disease in the community. There's more challenge from different bacteria, fungi, and viruses on a daily basis, and people's immune systems may be more switched on or have immunological memory that enables them to deal with the virus more rapidly. So there are a few different theories there, and it will be important to figure out which of those is the real answer.
Right. What about, let's develop that a bit, the immune system. We have a tradition of yoga and Ayurveda, which now people are saying that, this is the moment to sort of rediscover that and to build our immunity and to talk prevention rather than cure. Do you think that there's some substance there?
I think that the practices such as yoga and healthy living are obviously very important, but as a scientist, I don't think that the impact of those things is significant enough to have a public health impact. I think it's great for well-being and dealing with the crisis at hand, but good nutrition, exercise, yes, they're key things, but really good health, good cardiovascular health, controlling diabetes, blood pressure, heart disease. As a doctor, it's kind of, where those things are drilled into us from early on. And we also see in the clinic here, the people who have gone on to severe illness and death are those who have pre-existing lung disease or heart disease or kidney disease or diabetes.
One of the extraordinary things about this virus is the inflammation part of the disease, the second stage. And I think that is something that people are now grappling with. That seems to be particularly scary, isn't it, Professor?
Yes, it's kind of unprecedented to see this going on. There are virtually no infectious diseases where this happens, and this is what's so interesting and scary at the same time. We get this uncontrolled inflammatory response with very high protein levels of various different molecules that typically don't reach sustained levels like this in infections. They may peak and then subside, but in these severe cases, it seems to go on and on. And the big question really is whether this is due to the virus just carrying on causing damage and carrying on making copies of itself, or whether this is the immune system going out of control and beyond regulation. We have a lot of checks and balances within our immune system to switch off these responses when they become damaging. And for some reason, potentially this virus creates conditions where the regulation is disturbed.
Mm. It's all too scary and too much like science fiction. When did you first hear about it? When did you first start realizing how serious this was? This year.
Well, we started hearing about it probably around January. I remember I recalled that it was in China, and I'd given some talks in China last year. I went to Shenzhen in November, and I'd come back and really enjoyed it. And then on the news very soon after was this new infection. I thought it was going to be just a pneumonia that would disappear like everybody else, and I carried on as with daily business. And then the cases in Italy started arising, and then we realized it was really going to be a pandemic, and it was spreading. And by April, well, of course, we were in the thick of it, and we had to shut down. So we continued. Our institute started working on coronavirus. So my own laboratory started working on coronavirus testing because the tests were taking too long. We also started a program of research on this inflammation you're talking about. We work on a cell type called macrophages, which are probably responsible for all of this inflammation. And so we have a background on understanding what's going on in these cells, and we're really trying to understand how the virus is causing this inflammatory response. And then we've also been looking at the genetics of the virus over time in particular patients and looking at evolution. So we've really switched all of our HIV expertise over to coronavirus for the time being, whilst continuing the projects in HIV that we were already doing.
So was there a point where you felt armed with a lot of knowledge and you felt people around you were not understanding the severity of the crisis and you wanted to shake them up and tell them, look, this is really about the Gupta lab? I find that very interesting. There are two labs that you work with or you've created.
Yes, so I mean, my research group has been in the past between two places. I mean, I have an affiliation with a large research centre on tuberculosis and HIV in South Africa, which is funded by the Wellcome Trust from the UK, which is a state-of-the-art lab facility with a big demographic and epidemiological components as well. So because of my HIV interest in developing countries and drug-resistant HIV, this has been a very fruitful collaboration and place to work. I had a small team there for a while in the laboratory, but now I've concentrated more in the UK. But we still do a lot of work in drug resistance in South Africa and also Nigeria, and also Uganda. So we're continuing a lot of work across sub-Saharan Africa. But for practicalities, most of my laboratory staff are now in the UK and Cambridge.
That's one of the most interesting things about what this virus has brought home. One of the few rays of hope. I think that there is a tremendous amount of global collaboration happening between scientists from across nations to work on a vaccine, to work on drugs. Is that something you see as a way forward for global science?
Absolutely. I think that global cooperation has been unprecedented. The availability of communications has been revolutionary for video conferencing, also exchange of data. The availability of preprint publication has been, I think, in general a good thing because data can be released. Of course, there have been a lot of very poor scientific papers as well, but the good has outweighed the bad in my view. And of course, the vaccine efforts across countries has been remarkable. The efforts in other areas less remarkable, but of course potentially ongoing, and will come to fruition in the future. But it really has been remarkable, and we need to sustain this.
There is tremendous pressure on those developing a vaccine to come up with a solution as quickly as possible. And one of the organizations associated with this is the Serum Institute in India, with which you must be familiar because of your work in HIV. There is a lot of concern that we could be racing too fast towards a vaccine without taking all the possibilities without including all the possibilities it could have, the repercussions.
Yes, I think I'm certainly one of the people who thinks we need to get the vaccine right first time, because we are, as I said, the mortality rate from the disease is declining in places we know how to treat it and detect it better. We are hopefully getting vaccine. We need to make sure it works and is safe. And, that may take a few more months, but I think those are very well invested months, because of course you have 5 or 6 different, or up to 9 different candidates. And we really want to choose the best 1 or 2 or 3. And it's not necessarily a race to see who's the first. It's a bit sad to see people racing to be the first, companies to make the vaccine because of the headlines. Of course, it's not about that. It's about the quality and the overall success and the long-term success of the vaccine. So we need to keep our mind on that.
Professor, is there one country you would say really battled the vaccine well on all fronts, whether it was detection, whether it was prevention, whether it was actual treatment?
I think, well, Germany seems to have stood out to some extent in Europe. It's sort of obviously hard to know, because we haven't really had first-hand contact with German doctors or scientists. Certainly I haven't myself. So it's often hard to know, whether the numbers are real, what's really happening, were there mitigating factors. So that's on the control front. But I mean, on the vaccine and science front, I think many countries have made significant contributions. Of course, we've had rather well-controlled epidemics, for example, in Vietnam and other countries in East Asia. And it'd be interesting to understand how some countries have done better than others. Maybe it's demographics of the population, age structure, living standards, living conditions, obviously the response to government measures, the degree to which people obey, government rules.
What about herd immunity? I mean, Sweden tried that. Was that successful?
It was a thought early on that we might be able to achieve herd immunity and therefore control infection.
Yes.
Really, but of course, with the lockdowns, we did shut down transmission, and so we made herd immunity a very difficult thing to achieve by shutting down. Of course, shutting down was probably the right thing to do, because we may have achieved herd immunity with the loss of many more lives. Mm-hmm. And if that herd immunity then wanes, for example, as I said, you can get coronaviruses year after year, it would have been a big waste. So because we don't understand how long immunity lasts, aiming for herd immunity by infection is a risky thing.
Professor, I wonder, when you started out to study immunology, epidemiology, did you ever imagine it would become possibly the biggest and the most exciting field in a way? Deadly, sure, but also very exciting that it's become now?
Well, I mean, this is the reason I got into HIV in the first place. When I did a master's in public health at Harvard some years ago as a medical student, and I was introduced to courses on HIV and how they affected different countries. And that's a disease that really ticks all the boxes of immunology, virology, sociology, politics, across the board, gender, so that I already was dealing with the most interesting virus in the world, and this comes close, but it's still not quite as interesting as HIV, I think.
What makes it less interesting?
Difficult question, but I guess we're very early on in the history of this virus, and of course when I got into HIV, we were 30 years into the epidemic, or 20 years into the epidemic, let's say. And a lot more was known, and therefore it's more exciting. I guess in 10 years' time, this coronavirus may be equally as exciting, but there are many, many unknowns with this virus.
What has it taught us? What has it taught the world? Has any good come out of it?
Well, the thing is, I think the world doesn't really remember things very long, as the economic, turmoil has shown us time after time. It's because there's a business model of making money and looking at the short term and being elected every 4 years, and these are the things that drive things in the wrong direction, including climate change. So I'm not very hopeful globally. But I'm hoping that investment in science at least will continue, because we know that this could happen again next year. So even for the short-termists amongst the ruling elites, they may have enough sense to realize that this is not the last that they're going to see in their own lifetimes. And so hopefully we will have more research into basic science as well as translational science into viruses, but also other pathogens.
What about the healthcare systems? Does the world now realize that it needs to invest in it, otherwise it will be too late?
Well, I think we knew we needed good healthcare systems all along. We've seen that TB is still rife in India and various other countries. And this is a disease for which we have treatments, which should not be here anymore. So we know that our healthcare systems have been underperforming. And of course, this added insult of coronavirus has just made it 10 times worse. So I'm not sure. And of course, healthcare restructuring is a different order, is another order of magnitude compared to science investment. And so that's going to be a lot harder to achieve, I think.
Why is there such little will among politicians to fix healthcare when it's obviously a crisis staring them in the face?
Again, it's economics. It's going to cost too much because people, when you make their health better, they live longer and then they need more care later on. So,
but they also vote for you longer. Why can't they see that?
Interesting. Yeah. So that's right. The incentives aren't there. You see, healthcare restructure doesn't happen in a 4-year term.
Yeah.
And the effects of poor healthcare usually don't come to affect the politicians so regularly, and they just pass. It's one thing that can be passed on, and that's the issue, I think.
And that's been happening all over the world, I think, from America to India. I think that's been the biggest issue.
Yeah.
Thank you so much for joining us and for giving us so much time. I know that your time is valuable currently and always, but thank you very much and all the very best.
Thank you very much.
Thank you.